Hello, everyone. And thank you so much to the Planning Committee for your commitment to all of the modifications and adaptations that you have made. Thank you for the invitation to share our work here in the United States at the University of Texas at Austin. I hope everyone is well and safe. My presentation today is about the importance of providing opportunities for health behaviors during the school day. In my presentation, which is a brief overview of the background of our learnings and understandings of physical activity, uh, healthy eating, and early childhood, and how early childhood education has changed over time. I will also discuss some comprehensive models that we are using here in the United States and locally, and I'll make some recommendations for teachers, administrators, and parents, and how we can pursue this notion of healthy eating and being physically active as part of a necessary portion of child development. As we know, children are less active than previous generations, and this inactivity has really led to chronic disease that has been associated with sedentary behaviors. So much so that it's become the fourth leading cause of mortality, and it has cases and incidents of morbidity. Young children participating is far below the recommended hours of three hours of playtime. So young children who are less than 5 years old should be playing in 3 hours of structured and unstructured playtime, and yet that is not taking place. Only 33% of children who are ages 5 to 17 participated in the mandated 60 minutes of moderate to vigorous physical activity each day. Only 1/3 of our children actually meet those guidelines. And in Brazil, a study that focused on the same concepts of engagement in moderate to vigorous physical activity, children spent about 56% of their waking hours in sedentary time. And of course, this has happened because there is now streaming video, there is now cable television, and that only leaves about 2% of the time for vigorous physical activity. What do we know about healthy eating in children? Well, it's important that children consume the macronutrients because this is required for progressive brain development and healthy brain development. But yet, what we realize is that fruits and vegetable consumption is far below those recommendations. Children consume more sugar and sweetened beverages than is recommended, and that is things like soda, energy drinks. At a very young age, they're consuming these sugar sweetened beverages. And we have concerns about inequities and health disparities in childhood obesity rates, particularly when making comparisons to whites versus Hispanic children. Healthy eating patterns really begin early in life, and we should focus on establishing those patterns among 3 and 4-year-old children. Not only do we have these concerns in physical inactivity, a balanced, healthy eating diet, but we also have concerns about early childhood because there are changes within the structure of the school, and we need to respond to those changes. Full day preschool is becoming the norm, where children are spending almost 6 hours in a school day. This is time outside of the home, and it gives us less of an opportunity for the home environment to influence eating patterns and physical activity behavior. But it does present an opportunity for schools and teachers to educate children about the importance of physical activity and healthy eating. I like to think of it as an opportunity opposed to a deficit. In schools here in the United States, there are several models that we are using to comprehensively address concerns related to physical activity and healthy eating. One model is called the whole school, whole community, whole child, where we think about the creation of health first policies and the importance of integrating physical activity opportunities across the school day before and after school as well and into our community. And we also consider how we can connect those physical activity opportunities to those of healthy eating. One example of a physical activity program is called the Comprehensive School Physical Activity Program, where physical education is the star of the show, and there's formalized education about human movement. But there's also physical activity during the day, such as recess, classroom physical activity breaks. There is physical activity before and after school, whether that's a formalized program of youth sports, or it is physical activity such as riding your bike to school or walking to school. There's also teacher involvement, and all of the staff embrace the notion of physical activity across the curriculum. And of course, all of this is supported by the family and community and their involvement in the lives of children and the opportunities that they provide within the community to be physically active, like parks and green space and recreational programs. Well, what do we need to make these things happen? Sometimes we're faced the reality that there are inequities within our curriculum, and that some schools have more resources than others. Some teachers have been trained in slightly a different way and don't feel comfortable or are not prepared to offer physical activity or healthy eating choices within the school. We need to address these inequities by providing teacher training, equitable resources, and equipment for all individuals so that children can participate in physical activity, because these things are predictors of physical activity engagement by the children. We want to liberate children so that we remove all barriers and they can be engaged in structured and unstructured play. We also need to have healthcare and equity ambassadors if this is just change is going to happen within our schools. In the United States, we have the Alliance for Healthy Communities as a model of health and well-being, and we also try to create a culture of health within schools. Again, these are examples of comprehensive initiatives where all children are invited to participate in healthy decision making, whether it's for physical activity or healthy eating, and all adults support those opportunities for children. And so whether it's the members of the community, whether it's the policies that we create, a school administrator or principal, it takes a village to offer these opportunities for children, and these models suggest that we all need to work together to make that happen. So what are additional things that we need for these offerings? It's suggested that school policies consider health first. So many times we are a well-intended policy to increase our knowledge in science, technology, engineering, and math are created. But what happens is that it's at the expense of recess or physical education. So we need policies that think about health first, and then we need to implement those policies as intended. Principals, administrators, those who are key decision makers within our schools need to be supportive of such policies and the development of those policies. They need to provide assurances that there are equitable distributions of resources and administrative support of teachers making decisions to take a physical activity break during academic time. Um, Administrators can be very influential in cases like this, and whether they're supportive or not supportive. Teachers need to model that physical activity, and we can provide cues and signs within the school to say, it's now time to play. No parking on the playground because it's time to play. And we can offer other incentives within the school day, such as if we work really hard during our academic time, then at the end of the week, we get some free time that's physical activity, or the class gets to choose the physical activity. Specifically, what recommendations do we have based upon a summary of literature that we have conducted? This idea of adopting a whole of school approach where all adults and even the peers contribute to this notion of being physically active and taking a health first approach. Again, it must be comprehensive and a coordinated effort where messaging informs one another, and there are positive messages and opportunities for children to actually engage in this decision making. For the very young children, play should be unstructured as well as structured. So, imagination and parallel play, and sand play, and water play, and cooperative play are all examples of how very young children, at an early stage in the lifespan, can experience physical activity in a positive manner. Encouraging physical activity anywhere, anytime, whether it's on green space or as pictured here on a blacktop during recess or physical education, even if it's in the classroom. Human movement can happen anywhere at any time. And I'd like to emphasize that in our paper, we put the self-determination theory, which focuses on building competence, relatedness, and autonomy within the individual students. In the physical activity realm, that means helping students acquire motor skills so that they can be successful in their endeavors. Here in this picture, you see some juggling and tossing and catching and some agility going on. And also, this notion of building autonomy is structured on physical activity choices. Would you rather do A or would you rather do B? We also have recommendations for healthy eating, and the recommendations for healthy eating are very similar and parallel those for physical activity, taking that whole of school approach. It is not just the nutritional staff who are responsible for healthy eating options, but it's also the teacher. How are you going to handle birthday parties and whether there's cupcakes in class and when you have snacks and what kinds of snacks that you have? So, teaching children about a healthy plate and what is on a healthy plate, such as having nutrient dense, well balanced meals, that can all begin in the classroom. We need to think of eating patterns as a whole, as part of the child's life. Fueling the body is normal and necessary, but we need to balance that nutrition. We need to be sure not to overconsume or underconsume. So think about what's the ideal time to eat and what portion should be consumed at that time. We want our healthy plate to be full of multiple colors of fruits and vegetables, and we want individuals to choose new things to start to consume. So, for example, for a child who hasn't tried a kiwi or a star fruit or a mango, we want to provide opportunities for them to learn about new food substances, such as fruits and vegetables, that they can consume. Whether it's policy approach or whether it's from an individual oversight position by parents, administrators, or teachers themselves, is we really want to limit the consumption of sugar sweetened beverages. This came to the forefront about 5 or 6 years ago in the United States, and now many policies have been put in place limiting the consumption of sugar sweetened beverages within schools, but also the notion of offering products that are low sugar, low in fats, and low in calories in their consumption. So I believe the market is now being responsive to limiting the amount of sugar included in the potential beverages. And again, I want to use the self-determination theory to talk about the competence, relatedness, and autonomy from a standpoint of decision making. So we need to provide children the opportunity to choose fruits and vegetables. Is it going to be an apple or a pear today or an orange on your plate? How does this relate to healthy eating? How does it relate to fueling your body? And how does it relate to good health in general? And then the notion of how do I make the right choice and when do I make the right choice is also related to the autonomy. In our paper, we provided an overview of specific evidence based practices that teachers can engage in We also, in our paper, provided an overview for administrators and parents. So on this first table, I'm going to take a moment and highlight some things that we provided as specific, very easy to do next steps for teachers. And in the next slide, I will talk about how administrators and parents can be responsive. And these are things that we can do immediately to begin to promote physical activity and healthy eating among children. Teachers can think of themselves as health promoters, and they can model those decisions by choosing fresh fruits and yogurt and grains, and definitely taking a student-centered approach. Teachers are continual learners, and so engaging in professional development that keeps you on the cutting edge of innovative practice and how to teach very young children about the notion of a healthy plate. Teachers are champions, and they champion a lot, and they are asked to do that, but they can also be champions of healthy decision making. And in their practice, they can be habitually physically active. They can teach children about the long-term importance of being physically active and cognitive development and brain health. And teachers are organizers. So in those models, teachers were key players in providing opportunities and orchestrating and facilitating those opportunities to make healthy decisions. In order for children to make healthy decisions, they need to practice those decisions. Teachers are organizers of that content and provide opportunities for children to do so. I've focused a lot on policy today, and I think administrators have an obligation from a policy and financial standpoint. They allocate resources and they make decisions. If teachers and administrators can get together to collectively make these decisions, I think we can be more efficient in our use of resources and how we implement and adhere to the policies that are in place. And parents, of course, are key players, and one slide and one bullet point do not represent the role that parents play in their lives. But if parents can be involved in school and support the school curriculum and the healthy decision making in their home environment, what evidence has shown us is that children begin to demand those things at home. Mom, could you please buy some bananas this week? Or could we have some more fruits and vegetables? It would be great if we could go outside today. So collectively, administrators, teachers, and parents have a shared responsibility in fulfilling these roles. And I think by participating in this particular workshop, you're gaining an opportunity to be able to do so. And I wish you well in doing that. All of our work has come out of the Kinetic Kids Lab at the University of Texas at Austin. And feel free to contact us if you have questions about the models, if you find that you have a barrier in place that you would like to overcome. I thank you for your attention today, and I wish you well in your endeavor of promoting physical activity and healthy eating among young children. Thank you.